Okay. Can everybody see me and hear me?
Yes.
Okay. Thanks, Shalacy. And if you would please put your name and email address in the chat, and then we'll be sure and get the recording out to you tomorrow. And I'm not going to waste a lot of your time because everybody who's a client received an email. It's kind of short notice, but they'll get the recording. And at 5 after, we will start.
Yeah, Mike, this is
Yes.
Dwayne.
Hi, Dwayne.
Hello. Will we get the meeting notes? Like I see that you're recording the notes and all that, or is it just going to be the video? Just curious.
It depends on how well I can use the AI to get the notes. I
Okay.
can always run it through AI. Pardon me one second.
I get you. Thank you.
Hey, Clown.
It disconnected, Mike. I don't know if you have to let me.
Yeah, go ahead and try again. I'm waiting for Claudio Ramirez, who works for me, with me, and is an awesome person, has been working behind the scenes for me for 2 years and is now licensed and is able to support you and other clients. And she's super bright and talented, also bilingual. Well, heck, Clown. Okay, I'm going to start this and then I'll let in Claudia. She got bumped off. This is going to be a weekly webinar. Everything basically is undecided. As you probably know, we do not have a functioning government, and it's holding up Healthcare.gov. And we have, anything, and I got like, you'll see the number of calls and texts and emails I got today from people that expect to get answers. And that's what I'm using these webinars for, so I can share information with everybody so that you're not spinning your wheels and you're not spinning my wheels. All right. I already mentioned, put your name and email address in the chat to be sure you get the replays and the next webinar info. But I always use this, and this is the GOAT, Michael Jordan, the greatest of all time basketball player. And he was known, Michael Jordan was often asked, why don't you pick up the cause for Black heroes? And his answer was, because I turn off half of the audience for Nike shoes. And he owns, I don't know, 10% of Nike and is a multi-millionaire. We live in, and you can put in your own expletive in the caret. We live in very interesting times. And the more things change, the more things stay the same. I'm sure heard that before. But change is neither bad nor good. Change is inevitable. Change drives opportunity. But this year, this is, insert your own expletive, ridiculous. We have, remember cash for clunkers? We had to bail out the automotive industry. 2008, we bailed out the banking industry. We bailed out the healthcare industry. And we bailed out the insurance industry. And big pharma is so dominant and spread so much money among Congress and everybody in politics that they're too big to fail, and that's a problem. The biggest failure of all is Washington GG, and that is not a typo. That stands for District of Grifters, because anybody that is a politician in my book, especially right now, is a grifter. And so what happens is we have all become pigs at the trough, and I'll explain that in a second. And the result is that we are the herd is being thinned very fast, and this has resulted in too big to fail in key industries, including healthcare insurance. And this is a double carrot. Put two expletives in there. There's unprecedented change in Medicare, under 65, and healthcare and insurance. And I'm a subject matter expert in all this stuff. My approach has always been to never run away from challenges, to run to the fire. And this year, I'm adding to that. In spite of commission reductions or elimination, I've made major investments in my business. Got a full-time staff of 3. We have a fully functioning website and social media presence, which I'll talk to it for a second. Also, to be compliant, all recordings of all inbound and outbound calls must now be recorded and stored for 10 years. I guess that means I'm going to be around for a while. Secure and encrypted links. You can no longer pass to me in an email your doctor and prescription information. There is a secure and encrypted link for you to do this. Links to all the recorded webinars during the series, which goes through November 12th, will be sent in an email the next day. This is not new. There's no out-of-network coverage in Texas and most states, so travel may be an issue, and HMO plans that require referral. Knowing if your doctors and hospitals are in network is essential, and also in urgent care. But I got to tell you, this year, for 2026, you're going to have to make compromises, because it is going to be rare that all of your doctors and your hospital is going to be in any particular plan's network. And it could change. Also, Aetna is no longer participating at Healthcare.gov. Other carriers have eliminated commission payment for ACA plans, and you have 10% healthcare inflation and reduction and elimination of subsidies for health insurance. Now I'm going to explain this. This year, below, and this is for Texas, some of you may be for outside of Texas, below 100% of the federal poverty level, FPL, there is no premium tax credit. Also, during the Biden era, this was expanded out to like 600%. So, you have people that are used to getting a big subsidy, they're not going to get it next year. If your household income that you estimate is below 100% of the federal poverty level, next year there's no premium tax credit. You pay the full amount. And 150% or less than the kid's application for under age 95 goes to CHIP, Children's Health Insurance Plan. Here is what, and again, this is not official, but if the premium tax credits are not expanded, and there's a good likelihood that it will, you can see how much of additional premium people will pay this year. And this, this is based on number of people in the household. It can make a big difference. And this is from Kaiser Foundation, a very credible source. So that's why I'm starting this tonight, and it's going to go throughout November 12th, so I can share information with clients and prospects as I learn of things. And I'm going to share just a tiny little bit of it today, because a lot of it is still up in the air. Now, I'm going to ask, please, please, please read your emails. Literally, I received 43 texts, 32 emails, and 20 phone calls, which I answered through 3 p.m. today. And so I'm not getting stuff done. So I'm going to have to just shut it down except for emergency calls or from a new client. I have to get stuff done. The purpose of these ACA webinars is to share information as I learn more and answer your questions. Like I said, the Obamacare information is undecided, and it's only 2 weeks from Saturday before open enrollment is supposed to start on November 1st. And I have over 250 Medicare clients and over twice that many Obamacare clients who have entered their info and are waiting recommendations. And I can't get them out because I'm answering calls from stuff I shouldn't be answering, calls or texts. I have to get work done, not answer questions from people that didn't bother to read their emails and call, text, or email me. So sorry, I'm a little agitated. As I know more, I will share more during these webinars, and we will send an email with links to the recordings and resources the very next day to the email that you put in the chat. This is the link that you used. It's the same link to get here, and this will be in the outbound email in case you don't have it, and you'll get that in the email. So, in the words of the immortal Rodney Stewart, can't we all just get along? Now, prior to Healthcare.gov, we had underwriting. And we're going back to that time where you have to unbundle your insurance to reduce risk and cost. You have an unhealthy family member who should probably be on COBRA if it's available. You may have or onto a plan through the Affordable Care Act because it covers any and all pre-existing conditions. A college student, oftentimes the best option is a university plan. And out-of-state family members need to be on their own plan. I'll also be covering options. The only thing you need to know is that they all will exclude pre-existing conditions and can also reject the application, except for employer health plans and COBRA and Medicare. Now, here's a strategy. Convert in a year that your tax bracket is low enough money from into a Roth conversion to generate taxable income to meet the minimum income. You don't have to do that now. You could wait until the end of 2025 to achieve the income to qualify for a premium tax credit, no matter what that is in 2026. It'd be speculation on my part to even mention it. Now, 26 and 27, there's a shortened enrollment period. I may actually get to spend Christmas with family in 2027. Also, federal income taxes must be current. If you have not paid your federal income taxes for 2024, there's a good possibility, we won't know, but there's a very good possibility you won't be eligible for any premium tax credit, or possibly not a plan. Premium tax credit, your actual versus estimated 2024, must be reconciled in order for the application to be approved. Something else. In past years, you could just not pay your insurance premium. No longer. If you default on, let's say, December insurance premium and take the risk, you may not be eligible to enroll for 2026. Again, the rules are not finalized, but according to what I read, that is a possibility. CHIP Medicaid, which is a great program for those with limited incomes, there's delays due to Medicaid funding reductions at the federal and state level. There's also reduction in advertising and outreach funding for people at Healthcare.gov. And this was I don't want to get into politics, but this was a gravy train for a lot of those organizations. And also there's a reduction in the number of navigators and assisters at Healthcare.gov and third-party organizations. At the same time, commissions have been reduced and eliminated in some cases for insurance brokers like me. November 1st, 2025. And again, this assumes that everything happens on 2025. The expanded premium tax credits implemented during the Biden administration expire at the end of 2025. And they're probably not going to be extended for 2026. You may have had a zero premium plan for 2025. Well, you're going to have to pay a minimum of $5 next year for an insurance plan. And if you don't, your plan will cancel. There's also a $9,500 out-of-pocket maximum for 2026, and changes in all of the drug formularies and in-network providers, and a reduction in the plans and carriers offered. And you're going to have to get a new agent of record form digitally signed, and that will happen through the retireflow.com/exchange link that will be sent to you tomorrow. Now, catastrophic. There's a lot of definitions of catastrophic. Here's the one that is at Healthcare.gov, and you can read this now. Healthcare.gov/choose-a-catastrophic-health-plans. There is a form, and I encourage you to fill out this form now, because you may qualify for what's called a hardship case. If you had a premium tax credit this year, but you don't qualify for one next year, you better complete this now so that once open enrollment begins, you can enter it, and who knows how long it'll take to get it processed. It's not like there's a lot of people working in Healthcare.gov right now. No, don't be cheap. This too shall pass. You can afford, you need to measure how much you can afford to risk versus how much you can afford to spend per person, not per family member, or not per family. And if you've got a cheap spouse or husband, don't let them make their own healthcare decisions for the family, nor trust the call centers or Healthcare.gov. Very few experienced people at Healthcare.gov, and their role is to slide you into the second lowest cost plan and see how many applications they can complete in a year's time. They're not going to go through all the laborious process of seeing which doctors and which plans networks. So you don't know what you don't know. What you don't know could put your entire family at risk. So do what you do best. Return on time invested, and know the difference between opinions and expert advice. Everybody thinks that they're an expert or has some inside track. You got to understand, I live, eat, and breathe this stuff, and 24/7, 365. So, be very careful who you trust and believe. Right now, I'm in overload. This won't be forever, but I'm in overload. So I've got all of these Medicare clients and also people that have completed the RetireFlow link to send them secure and encrypted emails. But I can't send ACA options until Healthcare.gov releases all the information. Also, outside the U.S. or even outside the state, you're probably not going to be covered, whether on an ACA or Healthcare.gov plan or an employer plan. So don't be fooled by the minimal coverage plans offered by travel agencies. International medical coverage, if you're going on a cruise or something like that, it's very affordable, much more affordable than in the U.S. And so we are living in, insert your own swear word, interesting times. How can you help me help you? Attend the weekly webinars or watch your recordings. I know you can't attend everyone, but ask your questions in the chat. I'll open it up to questions in a second. Limit your phone calls and texts and emails to medical emergencies from clients and for new clients. This is going to have devastating impact on people who think that, oh, okay, I only paid this much in 2025, and I expect to pay this much for next year, and it's going to be the same. Nothing could be further from the truth. So who do you know that could benefit from these webinars? I've already completed 3 Medicare webinars. And I'm doing, I guess, 5 ACA and Healthcare.gov emails. This is the first one. And please forward it to your friends, families, and neighbors and say, hey, this guy knows his stuff and he has a team behind him that can answer your questions. Because without that, they're going to make mistakes that they regret. And there are so many, there's so fewer do-overs in 2026 that would allow you to change your plan. So it's better to get it right from the start. Now, in January, there's also a form, you'll get it tomorrow, for life insurance and short-term and long-term care living options. And there's a link there. And I'm not going to worry about that during open enrollment, but in January, I'm going to start working these down. Many have already requested information. My agency represents most companies, and I'll help you all the way through and understand. I just can't do it right now. Also, dental and vision and other plans will be posted on the website and in social media. And I have never been a big fan of social media. I've had on my Facebook page a single picture of a 1963 Chevrolet long bed for like 20 years, but I'm now going to use it so that I can share information, and hopefully you'll share it with your followers. All right. So, reviews and recommendations on your socials. They'll include YouTube, Google Maps, Facebook, Instagram, etc., and requests for introductions and referrals. Now, enjoy the rest of your day and evening. And, this is my philosophy, and I live it. Okay? Help someone each and every day. I am 71 years old, and yeah, I love helping everybody, but this year I'm asking you to meet me halfway, and hopefully I will not get as many phone calls, emails, or texts for the balance of this week, but I wouldn't bet on it. Here's my philosophy: live with purpose. At 71, this is what drives me, is to live with purpose and to bring joy to the world. And like I said, this is short, but I want to answer questions, and I'll be happy to answer them if I know the questions. But, a lot is undecided and may be for a couple of weeks. So with that, I'll be happy to answer questions. And Clau, if you could read them to me.
Sure, Mike. Anyone have any question for Mike that we can ask? You can put it in the chat or open your mic to talk.
No, I don't have any at this moment, but thank you both for this session. And I'll be looking forward to attending the following sessions. So I know this is a lot.
Yeah, and hopefully, the rules and regulations will be released within the next 7 days. There is a government agency called REGTAP, REGTAP, that is under CMS, Center for Medicare Services, which includes Healthcare.gov. And they have canceled two agent webinars. They have another one tomorrow, and it could get canceled too, but hopefully I'll have more to share the next week during the webinar at Wednesday from 5 to 6. And Clau, thanks for putting the links in here. And Glenn, it's nice to see you, buddy. Deborah, thanks very much. And I'm here to serve. and know you can count on me to the end of my days. Thanks.
And I have a big favor to ask. Some of you already posted your email, but I got disconnected and I couldn't write down the emails. Sonia, if you can put it again for me so I can get them. I saw several of you put it in, but the connection is disconnected, so I couldn't really write them down. Thank you. Some of your emails, I already have them, but I just want to make sure we're sending the information to the correct email. Okay.
And the email will come from mtchapman@medicalInsuranceExchange.com.
Thank you so much for putting in your emails.
Hey, Mike, this is Dwayne. I have one question.
Sure.
Real quick. Sure. So, anyway, the last job that I joined, they had terrible insurance, and I'm not a spring chicken. And I selected the worst thing ever. They had no health care, or they didn't have hospitalization, inpatient or outpatient. And at my age, that's not good. So it was on me, but they made it very confusing. So, but I have the opportunity to get back on my wife's teacher's retirement system healthcare plan, which I don't know. I haven't done enough research, but I'm thinking is probably the best deal because it'll never go away, unless she passes away, So I don't know.
Yeah, I understand. You can't ever predict that, but chances are, first of all, group health plan will cover any and all pre-existing conditions, and it's really the only question comes down to cost, whether you want to take the risk. You can write health plan during the company's open enrollment, and it's likely a PPO plan option, or there might be an HMO option, but it's likely to be better than anything you can get through Healthcare.gov. And I wouldn't hesitate on that, really.
Okay. That's kind of what I was thinking without doing 100% research yet. But yeah, I should have never got off of it in the first place. I was on it before. So, oh well. Well, cool.
Yeah,
thank you.
Last mistake I made.
Yeah, I'm trying to figure out if that's my biggest mistake or not. I already owe $25,000 to the hospital for a surgery. I'm like, oh God.
Yeah. I always say if I'm not making mistakes, I'm not trying hard enough.
Yeah, that's why I left my job though, which is kind of weird. But anyway, insurance is more important than work at this point for a second.
Yeah, absolutely. You can always recover, even if it's expensive. But why take the risk of a catastrophic injury? Forget the cost. Also, being able to access the doctors and hospitals you want to have, because the plans through Healthcare.gov, it may take you a long time to get in to see a doctor, and it's all designed to reduce access to care. So and also out of network, it's going to be out of network.
Cool. All right. Well, thank you.
Mike, I think Marvel has a question.
Sure.
Mike, this is Marvell.
Hi, Marvell.
I'm living back and forth between Texas and Florida, helping with my mom. And it is likely that I may have to move here, but I haven't done that as of yet. Do you think, I know can't really say for sure, but do you think they would still have special circumstances situation that would allow you to change insurers if you move to a different state?
Well, Marvell, I would say a qualified yes. And also, you want to look for plans that are not HMO based, but EPO based. Actually, right now, the second largest insurance company in the country for ACA plans is a company you may not have heard from. It is, and of course, now my feeble brain escapes me, but it is 2.5 million people. And, oh boy, what is it? I can look it up. It's a good option for you. And I'll send
Yeah,
that to you.
because Aetna informed me that, they're pulling
Yeah.
out, and I have Aetna this year.
Yeah,
So
there'll
I
be
have to
some-
change anyway.
And the other thing is, you qualify for special enrollment to change plans. But what I want to do is check the network to see if you would have coverage in both Dallas and Florida. You want to send me what zip code your mom's in.
Okay. Should I send that like on that link, that secure link that you?
Yeah, that's right. That's the best way because it goes right in my right into my quoting service.
Okay.
And I can't quote now. I won't be able to do that till everything's released. Hopefully not before long. Well, I'll be able to before long.
Right.
But
Okay.
we're gonna work as we receive the surveys. We receive the surveys, and so first comes, first serve. If you have your information first, then we will be able to quote to you faster than to the rest.
Okay. Yeah, I'll get that in.
Yeah.
All right,
Thank you.
thanks. Well, thanks. God bless everybody. Enjoy your evening, okay?
Good to meet you all.
You too. Thank you for keeping us informed.
Thank you.
Bye-bye.
Thank you.